and is the efficacy of an SSRI for menopausal symptoms in perimenopausal women. So first, just a little snapshot of why we would want to remedy hot flashes. And a lot of women, 25 million or more, are affected every year with menopausal symptoms. They carry a significant medical cost. Nearly 70% of midlife women are going for at least one visit per year related to their menopausal symptoms. At this point, the only therapy that has FDA approval is hormone therapy. And as many of you already know, HT has been on a steep decline in terms of use following the WHO reports. And currently, the evidence for the efficacy of SSRIs for hot flashes is inconsistent, and so effective therapies and treatments are needed. So a little bit of background about what we know at this point about SSRIs and hot flashes, that there's some anecdotal evidence as well as some reports in placebo-controlled trials that hot flash symptoms can be reduced with SSRI use. And very simply, mechanistically, what might be going on in terms of the neural release of serotonin having an effect on thermoregulation. As estrogen levels are decreasing, so are serotonin levels, and that may confer an increased sensitivity of hypothalamic serotonin receptors. That increased sensitivity may cause a decrease in the thermoregulatory set point, and that narrowed range may then cause women to have an increase in hot flashes. So the primary aim of this trial is to determine the efficacy of escitalopram versus placebo in reducing the frequency and severity of hot flashes. Secondarily, to determine if race modifies the effect of escitalopram. And additionally, to characterize the changes in relationships among hot flash, bother, sleep anxiety, stress, mood, etc. And you can read more details about those additional names in the protocol. So a little bit about the study design and the population that we're going to be looking at. It's a randomized, double-blind, placebo-controlled trial. It's 8 weeks of treatment on escitalopram, also known as Lexapro. The starting dose, which I think Andrea mentioned last night, is going to be 10 milligrams per day. And then when they come in for their week 4 visit, if their symptoms have not improved by at least 50%, then they will be taking 2 pills a day, or the equivalent of 20 milligrams of escitalopram. Perimenopausal women, of course. What was learned in SWAN is that African American women were actually experienced more hot flashes than we thought, which is contrary to this long-held clinical belief. So one of the aims of this trial, as you saw, is to look at the differential response by race between white and African American women. So hopefully we can enroll equal numbers of white and African American women in the study. Julie's going to go into this in much more depth in just a couple of minutes, but I wanted to give you just a brief overview of what this about 16 weeks, maybe a bit longer, is going to look like. There's going to be a pre-screen phone interview to determine preliminary eligibilities. Those women are going to complete 2 weeks of hot flash diaries as well as an eligibility questionnaire, mail it back. If they're still deemed eligible at that point, they would come in for screening visit 1 for their blood draw and clinical measures, and actually do another week of hot flash diary, which they would bring in, assuming that they're still eligible at this point, into screening visit 2. If they're still eligible based on that second hot flash diary, they would then be randomized to either escitalopram or the placebo group. They'll receive a 1-week phone call, sort of check in on them. They'll come in for a 4-week visit, at which point their dosage would be increased if they haven't had a 50% reduction in symptoms. Their final in-person visit is at 8 weeks, and for example, so the tapering, if a woman is on the 20 milligrams per day or 2 pills per day, they would have a 1-week taper in which they would take 1 pill for the first 3 days and then 1 pill every other day from that point. They will continue to do a diary and have a closeout interview at 11 weeks, at which point you would remind them to mail back that final hot flash diary to you. So that's what the sort of 16-week time frame would look like. We thought it was important to mention Leslie Tinker has us registered at clinicaltrials.gov, and The information here, you can see to look it up, and this information is also posted on the wiki if you wanted to reference back to it, but we are required to be registered here, and we now are. This is one mechanism that can be used for recruitment, and at the moment you'll see on the site that it says not currently recruiting, and as everybody's IRB approvals are in place and you're actually ready to be recruiting and to launch, that status will change, so it will let people know that this study is actively recruiting.